Hello, class. I am Jacinta Lane, and this is Amber Kennedy, and we are getting ready to present to you our project on our organization, which is Big Brothers Inc. All right. So Big Brothers Inc. Seeks to optimize the quality of life for veterans through patient-centered treatment and creating a support system within the family and community for continued success. We'll be using evidence-based practice in a therapeutic and non-judgmental environment. Our goal is mission resilience. We want to increase personal and familial and community resilience for the veterans in the state of Virginia. Our values are confidentiality, collaboration, loyalty, trust, brotherhood, sisterhood, and of course, resiliency.
We chose to address veterans because of the intense need for veterans and their mental health care. Some of the issues that occur with veterans are PTSD, substance abuse, depression, and anxiety, but there are a lot of barriers to them receiving those services. Within the VA system, there's a tiered system, and those who are identified as lower need receive less services, whereas those with high needs receive higher levels of services. Another barrier that we found was other than honorable discharges, which means they were discharged because of substance abuse or aggressions, typically because of PTSD that was untreated while they were in the service. Many veterans don't seek services because of the stigma within the military community. And they also can experience homelessness, which also diminishes their ability to receive services for their mental health issues. So some of the types of services that we're going to be providing are inpatient counseling. We're recommending 60 to 90 days, 6 to 9 months, depending on the individual's need. And we're going to be doing it based on an assessment that assesses PTSD symptoms. While doing inpatient, they will receive group counseling, but that won't occur until towards closer to discharge to ensure the safety of all the members of the group engaging in that. And we also found it important to include family counseling because we identified that the community and the family, the support system needs that counseling and needs to have a better understanding of how to help their veteran. And by providing that really comprehensive treatment, we're going to show greater success and provide better quality of living for our veterans. We also included a transitional plan to provide outpatient following the time after their discharge. We did that because we didn't want to just get them to a solid place and then just put them out on the streets and hope that they're successful. So continuing that following discharge and providing that constant support after inpatient counseling, we found to be very important. So within compliance, we chose to be a nonprofit, and we're going to apply to be a nonprofit within accordance of the Virginia state. They have a 12-step process that we're going to follow. We will ensure that we have professional liability insurance, and we found some really great resources online that provide all of the different liability resources available. One of the ones that we found that we hadn't thought of was sexual abuse liability insurance. Because we are providing inpatient, we decided that that would be an important factor in that. We are absolutely going to be HIPAA and HITECH compliant, and we're going to be doing that by online HIPAA and HITECH secured services using smart cards known as CACs, and all of our online processes are going to be ensured to be HIPAA compliant. Our licensure and credentials, we are going to require licensure of marriage and family counselors, or just LPCs, or a combination of both. And we're also going to provide BTs, which are non-licensed individuals who are there through the rest of the day to ensure safety and counsel and services while they're not receiving those individual treatment modalities. And then we did a lot of research on insurance credentialing. We found that CAQH is a really great resource where all of our therapists are going to be licensed through, and that increases our ability to be credentialed through insurance companies. It's a nationwide system. And primarily the insurance that we found that we will be working with is TRICARE, because all veterans have TRICARE as their resource. And we researched all the different method or steps that we would have to take to become credentialed through TRICARE, and CAQH was one of them. Do you want to pick up on this one, Jacinta?
Yes. So ensuring ethics through policy. Our ethical standard is avoiding harm and imposing values. Avoiding harm and imposing values. Okay, so our policy at Big Brothers Inc. is to protect the individual rights of all patients so that they feel safe expressing their views, thoughts, or beliefs without judgment. We also are going to have a procedure where we provide written reminders of the policy in all public and community areas within the facility. Any staff who violates this policy will be addressed with the potential of termination if the behavior continues beyond one incident. Our goal is their comfort. We want to make sure that anyone who is a part of our agency is able to speak freely, comfortably, and get healed from all of the trauma that they have dealt with. Another ethical standard is with group work. Our policy is that group work will be processed with consideration for confidentiality, privacy, dignity, and free from verbal or physical violence. It is very important that a safe space is curated. Again, the goal is for people to speak freely and to get free from the trauma that they've already experienced, and to not be judged, and to feel safe as they speak about it. Our procedure will be group work will be conducted following assessment for appropriateness and stability for participation. Upon being placed in a group, the group will be provided with clear expectations, given redirection if necessary. And if at any time a participant continues not to meet the expectations, they will be removed from the group until they show that they are able to come back into the group. Again, we want everyone to get well. We want everyone to be helped. But if someone is impeding others from getting the proper help that they need, we will remove them from the group.
Okay, and we will be we expect to be treating court mandated clients because of the volatility of PTSD, which increases the potential for criminal behavior, as well as the amount of homelessness, which can also increase the potential for behaviors that could cause problems within the law. We assume that we will be treating some court mandated clients. And to do so, we will be working with the VA and the court systems, the Veterans Treatment Courts, the Veteran Affairs Collaboration, and we'll also include a peer mentoring component with our court mandated clients. So our HIPAA compliance will include an EHRSs, and we found that the important aspects of our EHRSs are to have data segmentation, which means that not everyone has access to all of the records, role segregation, and that really looks like our BTs won't have access to our clinical progress notes, and permissions assigned by roles. So who can do what within the system according to their role within our organization. To ensure HIPAA, we will mandate consent prior to sharing, probably through the use of a form where they fill out before we share any of our documentation or records within our system to ensure that HIPAA compliance, because we find that really important And we find it important for any medical necessity, but mental health, because of the stigma and because of all of the aspects of mental health, we want to absolutely go to the nth degree to make sure that consent is gathered before providing anyone with any confidential information. For our third-party reimbursement, we chose to use ICANN Notes, which is a HIPAA high-tech compliant. They have a variety of notes for all services that would include our inpatient, our outpatient, our group therapy, and our family therapy. They also provide a really unique tool of outcome measurement, so we can address what outcomes our clients are working towards, and we can measure those outcomes. There's also a really important patient portal where they can access things as needed. We also chose Waystar, which is our billing technology. And the things that we found that they provided that were important were revenue capturing, financial clearing, claims management, and the most important part was reimbursement of denial services or denial for services. Through our research, we found that insurance companies frequently deny payment for services, and using Waystar, what they do is they identify those things beforehand so that we can address it before it ever becomes a problem, to ensure that we're getting that constant reimbursement. So our fees and accessibility, we set according to Medicaid. And I found this to be one of the most challenging parts of setting up a business, was identifying how much we're going to charge for services. Fortunately, we found from Virginia, which is where we're going to be addressing these services, a list of what Medicaid pays for all of our services. For inpatient, we will charge $393.50 a day, which is what Medicaid does reimburse for. And for outpatient, we will charge $72.06 for a 60-minute session. We found that setting it according to Medicaid, which is kind of a standard, was going to be the most effective and also the most accessible for our clients. Our community outreach, we chose, there were so many options that we could choose from, but we chose suicide prevention because suicide is so significant among veterans. We're going to have a rotating on-call schedule for our therapists for those in need throughout the community who may be experiencing suicidal ideation. We will also partner with TWV, which is Partners, or I'm sorry, I forgot. It's an organization through the government, through the Veterans Association, that works on reducing stigma throughout the community and increases accessibility for it. And so we chose that one as absolutely our top necessity, and providing that resource for veterans with suicidal ideations. The second one we addressed was meaningful employment. So we plan on partnering with companies to increase employment for veterans. And through our research, what we found was that most companies get a one-time training on accepting veterans and don't really have anything continuous after that to ensure that success of those veterans within their organization. So we intend on providing that continuous training and continuous follow through to ensure that our veterans are able to engage in meaningful employment that's continuous, so that they are successful. Do you want to cover this one, Jacinda?
I do.
Great.
So responding to the community's crises, we would collaborate with our local law enforcement agencies, EMS, firefighters, the National Guard, and other behavioral health professionals to include FEMA too. So one of our certifications that we want to do is a CERT certification, which can be received through working with FEMA. And it works as far as any natural disaster, everyone would be able in our facilities, if you worked with us, they would be certified via CERT so that they could help in a crisis, i.e. 9/11 or Katrina like type things. They would be trained in order to help calm down some of the chaos and direct people to where they need to go in a safe manner. So we would work with law enforcement agencies, discussing with them what's going on. If there's any type of issue in our facility, we would have relationship with them. Again, with EMS, we want to know who our local EMS and our fire department are, so that we can contact them, so that we can be as close as possible. They can know what's going on and be prepared for calls at any time with us. And of course, National Guard, again, if there's a crisis, if there's an emergency and the National Guard is released, we want to be able to work closely with them and let them know what we're doing in case of an emergency.
Great. We chose for our internal agency crisis response something called Sanctuary Model, and I love talking about it because my current facility where I work at is implementing it now. But I skipped ahead because now we're talking about trauma-informed care methods. I'm going to let Jacinta go on this one. I got
okay,
excited, I jumped.
Right, I was like, you're so excited about it, but it's all good. They'll get your zeal too. So we're doing the trauma-informed care method. We want to work with organizational risk management, engagement with the community, clients, and staff. Engagement with the community is so important. We want the community to be completely aware of what we're doing and to tap in. When you involve the community, they can pour into the veterans. The more that we talk to the community about what it is that we're doing, the more it goes back to how we can get them into job placement, into local areas. If we talk to local business owners, we can continue to have maybe some work programs for our inpatient clients, or even our outpatient clients. We also want to engage our staff. We want staff that love what they do. We want our staff to believe in the vision so that they can continue to carry the vision out with us. And the clients, we want them to know that we're there for a purpose and that we do care about what it is that we're doing. So we want them to be a believer so that they can take their treatment as serious as we will. Also, our training, we want to train, make sure that it's a safe, collaborative, and compassionate set of training that goes back to, we want you to believe into the vision and to also help carry it out. So we want to make sure your safety is first. We care about our staff, but we also want to make sure that we work together. We want whoever wants to grow at our facility to grow and to work alongside us as we work alongside the veterans. But Amber, I think it's your turn. Go ahead to your
Sanctuary. Sanctuary I find really important because it doesn't just address after a crisis, it ensures a safe environment so that everyone is feeling safe prior to a crisis. And it really addresses organizational trauma. It's actually really fascinating to me. Some of the things that they talk about for all staff members are self-care, safety plans, goal setting, and community communication and support. And it talks about how having an open environment where everyone can express their feelings and their needs within the environment. And actually what they believe is that it trickles down to the care of the patients. The red flag reviews are more driven towards after a crisis, an internal crisis. And that's where you have a crisis and everyone gets together and they have their open communication about the crisis. And then they come up with goal setting and plans for moving forward. Sanctuary model is driven by 7 commitments. One is commitment to nonviolence, commitment to emotional intelligence, commitment to social learning, democracy, social responsibility, growth and change, and shared language. And by implementing all of these prior to an incident occurring where things need to be addressed, you have a safe environment already in place. So once an environmental problem does arise, everyone is already used to that environment and can feel open and talk about that experience. So interagency collaborations. Jacinta, I'm going to pass this one to you.
Okay, good to go. I was going to say, I could see why you were excited about the last one.
So cool.
Veterans Affairs healthcare system. So we want to bridge the gap of veterans waiting for care and partnering as referral for patients. So Working with veterans, it is really hard to get into the VA system to get access. And when it is accessible, it's not always consistent access. So the goal is to help alleviate the pressure off of the VA system. We also want to work with the Veteran Affairs Department of Social Services. We want to provide assistance in housing, finance, mood, relationship, and physical limitations. These are all issues that we know that veterans struggle with. Many of them have physical limitations due to ailments that they've received in combat, or even just because they have limitations. We didn't put mental, but mental limitations can keep them from doing what they need to do as well. Housing, we know that there is a homelessness crisis among veterans in the country. Financial issues, we know that's an issue because we just discussed homelessness. And mood. PTSD is, although not a visible issue, it is truly an issue that needs to be addressed. So we want to work alongside the social workers to find resources for our veterans and to get them access, not just find the resources, but how do we work together to actually get you into those programs and to help you not only get in, but be successful. So again, that's that, working alongside them. Also with the criminal justice system, we want to collaborate to decrease incarceration and and basically by decreasing incarceration and recidivism and all that other stuff, what we want to do is we want to capture the veteran. Okay, they got in trouble, that's unfortunate, but what can we do now to, one, break the cycle, and two, help them? Because many times when they get in trouble, it is because of an untreated mental illness. So we want to capture them and then reintegrate them into society with the tools that they need so that they can handle their stressors.
And our last piece was advocacy, and there's so many places we could have chosen to address advocacy. We chose these two. One of them is legislation HR 3749, which was passed in the House, but it has since been tabled and is still has no movement forward. And that was a bill that worked on providing legal assistance through the VA for veterans. The fact that they don't have that access to legal help has been really detrimental and has caused more incarceration and more legal problems for veterans, and can also affect them financially because they don't have access to it and they have to pay out of pocket. So we chose to advocate that we want that bill to be pushed through and actually become a reality for all of our veterans. The second one we chose was something called TAP, which is the Veterans Transition Assistance Program. And through the research that we found that it's not effective or actually taken seriously prior to a veteran transitioning out into the community. Many veterans referred to it as a checkbox that their supervisors went through, but there was no real follow through or real action behind it. So we would like to advocate towards ensuring that that's occurring on a substantial and realistic level to ensure that our veterans, before they even transition out of the military, have the resources that they need and are provided with those resources. So we want to advocate for increased use and successful use within the military system. And that's our program for Big Brothers. And I'm going to play our resource slides. I found this to be a really interesting project, and I think Jacinta can feel the same, or can say she felt the same. I learned a lot about our military programs and how they're not adequate.
Right. And I actually have a very special place in my heart. I worked with the military for about 6 years. So I'm familiar with some of the programs, like the TAP program. I know pretty much every personnel that I work with that retired out or that just, transitioned from being into getting out, have gone through that program, and some have succeeded, but it has not been a great number. So and I'm not talking about because of the program, but I mean, like let me rephrase. Some have succeeded with the information from the program. Many of them have succeeded, but the program TAPS did not benefit necessarily in their transition from military life to civilian. And I've noticed that that is a hard transition for many military people. And it's hard to go from extreme structure to no structure at all. So this is definitely a wonderful project to get into.
Yes, and actually my son is currently working on leaving the military and he's going through a lot of this stuff. So including filing for disability and being tested for disability. So I think it had a special place for both of us.
Absolutely.
All right.
Well, thank you guys and
Thank
have
you.
a great day.
Bye.